Hi, and welcome to this installment of Bergeron Briefs. If you haven't seen this show before, my name is Arthur Bergeron. I'm an elder law attorney. I'm at a firm called Myrick O'Connell. There are 60 of us. We have 40 in Worcester and 20 in Westborough, right close by. I do nothing but elder law. The other 59 do other stuff. I do a lot of presentations to seniors because of my work. I do a lot of seminars, and I try to supplement that with this show, Bergeron Briefs, the purpose of which is really to introduce you to the people you need to know as a senior or as a person who's working with a senior. And one of those people today, and she's really important to you here in Northborough, is my friend Cindy Cormier. Cindy, thank you very much for coming on.
You're very welcome. Thanks for having me.
And you're not from Northborough, though, so you're from this faraway place.
No, I was born and raised in Hudson,
born and
I'm
raised in
still
Hudson.
there.
Still there, right? You're like a true local.
Hudsonite, yes. Yeah.
But you're doing some stuff in Northborough. So this project called Dementia-Friendly Communities.
Come to be dementia-friendly.
Come to be dementia-friendly. And I know for the folks who have watched this show, they've learned a little bit about this, because I know I had my friend Carol DiRienzo on a few months ago to kind of talk about this.
I'm working with Carol.
And that's very exciting. So I guess what I'd like you to do is just kind of talk a little bit about what the project is, just for background and for people who didn't see that first show.
Okay.
And then maybe we can talk a little bit about what's happening right now, actually, kind of as we speak here in Northborough and in the two other communities where this is working, and we'll kind of go from there. So tell us a little bit about the project.
Well, I'm working with Bay Path Elder Services. Bay Path was able to get a grant.
Excuse me, Bay Path Elder Services, who are they?
They are in they are in Marlborough, and they are an ASAP, which is an Aging Services Access Point.
It was going to be a quiz, that's right.
Yeah, thank you. And they support 14 communities in this area.
And they're a nonprofit,
They're a nonprofit.
So you're not this isn't some kind of scam by somebody coming in.
No, it's not a scam, no. Okay. But they are the people that you would go to if you have an aging family member, or friend, whatever, and you're looking to find out what services are available. They're the place that you go to find that out.
I see.
So they were able to get a grant from the Metro West Health Foundation to bring somebody on part-time to implement what they're calling dementia-friendly communities.
I see.
So our program is called Come to be Dementia-Friendly, and it is based on a model that was developed in Minnesota. And those folks, they did a lot of work, and they actually put a toolkit together that's online, actonalzheimer.org. So in Minnesota, they implemented about 40 communities already they've deemed dementia-friendly.
Communities who have kind of gone through this process that we're working on here. I see.
Yep. And so yourself and the Council on Aging directors in the three towns that we're working in, which is Hudson, Marlborough, and Northborough.
So Kelly Burke from Northborough actually went out.
She's the Council on Aging director in Northborough. She went with you, and Christine Alessandro, who's the director at Bay Path, all went out to Minnesota and checked out what they were doing out there and thought, this is something we should do in this area.
We also love the fact that we were right next door to Mall of America. So we all got to see the real Mall of America, kind of up
big thing.
That's right.
So Bay Path brought me on to coordinate this effort in these three towns. And the intention is to implement it in all 14 towns or cities and towns that Bay Path currently supports. So right now we're working, it's a 4-step process.
Yeah, tell us about kind of how you got to where you are right now in Northborough, and kind of your sense of how all of that worked.
Sure.
And then if you could give people a sense of where it goes from there, that would be good too. Because one of the things that I think is really wonderful about this, right, is that it is on a pretty tight timeline. It's a process that...
It's about a year-ish.
Yes.
Yeah.
Yes, but it doesn't kind of go forever. So many people are asked to be involved in things, and they never end. As a volunteer, you die, right? Whereas this has got... And I think a lot of that has to do with you. I think you've been really making the trains run on time.
Oh, thank you.
So talk about how you got to where you are.
So it's a 4-step process. And the first phase of the process is convene, meaning getting folks together that want to do this. So it's a grassroots, community-level process. The only person that's getting a little bit of money is myself. Everybody else is on a volunteer basis. Each one of our directors of the senior centers, the Council on Aging directors, were very instrumental in kind of building the teams. We did a little differently in Hudson versus Marlborough and Northborough, but in Northborough, Kelly was great about reaching out to people in town. I'll call them the movers and shakers in town.
Yeah.
We have a fireman on the team, we have a policeman on the team, we have a healthcare, she's actually a nurse practitioner, people from assisted living facilities, all kinds of folks on the team.
A range of people?
Yes, somebody from every walk, well, not every walk of life, but many of the walks of life.
Yeah.
So we start out with an action team, and that action team is the one that will really drive this through the whole process. Once we had the action team established, we then went out to the community again, having a community meeting, inviting everybody and anybody to come to this meeting to learn about what this program is. Lots of folks signed up because the next phase, which we're in now.
And excuse me, so that community meeting happened about when?
That community meeting was probably about 6 weeks to 2 months ago, I'd say,
like
in
in
Northborough.
early June, or late May, early June?
Yeah,
Because
right
we're now in
around
like
there.
mid-July, right? Okay.
Yep. So we got those folks up to speed as to what we're trying to do, what we're trying to accomplish. And they are now out in the community surveying folks. There are 11 different surveys, and the surveys are all based on the different sectors. So there's one for local government, there's one for the hospital, there's one for clinics, there's one for faith communities, all of the churches.
One for legal and financial
one for legal
services.
and financial services.
I know this going
you're
because I'm
involved
doing
in
it.
Marlborough.
I'm doing some interviews in Marlborough with some of my fellow lawyers and financial people. Yeah.
So there's 11 different surveys based on who it is you're surveying. And each survey has a maximum of 16 questions. And basically they're asking, what do you know about dementia, Alzheimer's and the other forms of dementia? What resources do you know about that are out there? And those types of things. Do you come in contact? Do you have any knowledge? And so folks are out doing those surveys now. And we're expecting that we'll have at least 100 surveys brought back to us.
I see. And so are people being asked kind of what they know about dementia, but or also about any of their particular contacts with people who had dementia?
Yes.
Given the role that they have, given as a service provider, whether it's public sector or whatever.
Right. Let's just take a church, for example. Do you have people in your congregation that you think may be suffering with dementia? That type of thing. Do you have any support programs in your congregation, in your church? Those types of questions.
Right.
Businesses, have you been trained? Do the people that work for you know what dementia looks like? And if so, what kind of training did you have?
And I know from the conversations that we've had and from some of the stories that we've heard, you hear some really sad stories about folks that have interacted, and it wasn't good.
Wasn't a good
interaction. It wasn't good.
Right.
Can you give us just a couple of examples of that?
Right. Well, I think about...
We're not naming names, but just kind of talking about some situations.
The person that goes into a restaurant, and they've got that menu, and it's too much for them. Sometimes it's too much for me.
Right.
And to take a person that has some form of dementia, looking at that menu, it's just overwhelming.
Right.
So, we'd like to see where maybe that restaurant recognizes what that looks like and helps that person and gets down to their level and speaks clearly to them and maybe only gives them a couple of options.
Right. Can you mention gets down to their level?
When I mean get down to their level, I mean actually eyesight level, speaking directly to them.
Because this is one of the interesting things that I think we both learned about, was this notion that if you have dementia, literally your frame of vision kind of shrinks.
Right.
So that for the waitress to come up to you and stand up to you and
Speak
be talking
over you, right.
You don't see him.
Right.
You don't see him.
Right.
So you actually have to be kneeling. It's a fascinating, that's a fascinating
I
thing.
think about our first responders. Some of these folks are frequent flyers because there are a lot of things that happen, and it's possible that a person could be having some type of outburst. Well, we would want our first responders to understand that this is not something they can control, and also how to diffuse the situation. Don't add more fuel to the fire.
Right.
Learning how to talk to somebody with dementia in short concise sentences, keeping it simple.
Yeah.
Really helps to diffuse the situation.
And I suppose that's a really interesting example that certainly police are regularly trained to be trying to diffuse situations.
Right.
But it may be that those police do not know those specific characteristics of a person with Alzheimer's, and therefore what might set them off.
Right.
Or alternatively, what might really kind of slow them down, so they actually have to get some experience.
I can give you another example too. I know someone whose dad had dementia, and he went to a local diner every morning.
Yeah.
So they knew him there. And when things started to get bad, he kept trying to pay with his Elks membership card.
Yeah.
And they were like, no, that's not. And he would get more and more agitated. If those folks were better equipped, knew better what the signs were and how to deal with this person, he wouldn't have gotten so wound up each time, And Let me help you find the right card to give us,
Yes.
Don't just keep saying, no, that's not the right card.
Yeah, exactly.
I paid with it last week. No, you didn't, So.
Yes, and I think I remember you even mentioning an issue in the faith community with a woman who was literally asked
not to
not come back to the services.
Right.
Because of the fact that she was, for quote unquote, acting out.
Right.
Now, and certainly, as you had said to me, I remember, certainly you understand from the perspective of the congregation.
Sure.
You get that, but the question is, can you accommodate?
What can we do?
Because these are old people, and God's an important piece of their lives.
Right, exactly.
Of their lives.
And we've learned that folks that have dementia, or Alzheimer's, I will say, get into music. They enjoy music. So why can't that be the place that they go for that music?
Oh.
Right?
See, I can tell you've been out on the road a lot now. You kind of start developing a million of those kinds of ideas. So there's a variety of surveys now happening in a variety of members of the community. And one of the reasons I wanted you to kind of really talk about that was it may very well be that some people who are watching may get asked to be interviewed. And so we want people to feel comfortable that, once again, this isn't a scam. This isn't some, for profit that's trying to get in, to talk to you. That this is really part of a community effort.
Right. Yes, we want you to feel comfortable that we're not using your name anywhere. By answering these questions, you're not going to get in trouble because you haven't done something correctly. It really is to help us to understand where is the community. What do we know and what don't we know? And I think we don't know a lot.
A lot. So we're now in the middle of that, and we're in the middle of it in Northborough. Can you tell me where does it go from here, in terms of what are the remaining steps, and from your perspective, kind of what is the timeline for those steps? So
during July and August, the survey team, we'll call them, are out conducting assessments, surveys.
And they're real person-to-person type surveys.
Person-to-person surveys.
This isn't SurveyMonkey on the
No. We'd really like to sit down with you. In some cases, people don't have that time, so we'll lead the survey with you and come back and pick it up. At that same time, we're delivering you with some information so that you can start to understand what dementia-friendly is. We're giving you like the 10 signs of Alzheimer's and how to communicate with somebody that has Alzheimer's or dementia. So just that alone, I think, is going to help some of these businesses and organizations that we're touching. Once the surveys are complete, they're all coming back to us, and I'm giving them to somebody at BayPath, Elder Services, and they are going to tabulate the results of the surveys. That will happen in September, October time frame, and then all 3 of the towns will get their results at the same time. And the action team is the one that will then take those results, look at them, and try to determine what is it that our town needs to do based on these results. So they'll come up with an action plan, and they'll prioritize what those actions are, because some might be grand ideas and some might be very simple things that we can do very cheaply to get the ball rolling. So once the action team has figured out where we're headed with the what actions need to be done, there'll be a community meeting. The community will be invited to be involved in understanding where we're going, getting more folks involved. Hopefully some of the businesses and different organizations will step up and say, hey, we can do that very easily for you,
Very practical things being executed at the local level.
Maybe it's the library that has a reference area for caregivers like myself. I actually am a caregiver to my mother. And, I'm lucky to be involved in this world because I've learned a lot of the tricks and, that kind of thing.
Right.
I can't imagine going in without any knowledge and trying to be the caregiver. But anyways.
I remember you're telling me about that, just the kind of one of those basic pieces of knowledge about working with somebody with, don't try to have it not be their reality.
If they say it's Tuesday, it's Tuesday.
It's Tuesday.
What does it matter?
Right.
Don't be asking, what did you have for breakfast this morning? She doesn't remember, and it's not important.
Or what is my name?
Enter into their world and enjoy it.
Right.
Don't fight it, because it just causes you more stress and causes the person with the problems stress.
So your Northborough team is going to be doing a public meeting at some point, and when do you think those might be?
I'm going to say that's probably going to be October, November-ish.
November, to kind of talk about what's been learned and encourage other people, and then to try to do, here's what we want to do first.
Start rolling it out.
And start rolling it out.
Yeah.
So I know that you have, even before you got involved in this, obviously, thought a lot about this because you're dealing with your mother. Right? So you kind of see firsthand kind of what's missing in the world, or the ways in which the world doesn't deal well with your mother. So in your own personal vision of a dementia-friendly community, what is it about that community that's different from the community the way it exists right now? Right?
Again, I think it's really people being knowledgeable and recognizing that somebody's having a problem. You walk into a store, a person that has dementia walks into a store and wants to buy a t-shirt. They walk into the store and there's millions of articles of clothing in that store.
Right.
Extremely overwhelming. If somebody could recognize that somebody is having an issue and could help them and narrow down those choices, or maybe the music is blaring, maybe you could take them to a quieter part of the store and help them out.
Because the music is so disruptive to a person with dementia.
Right. Recently on TV there was a man, he runs a liquor store, and a gentleman came in, and this man, because his family member had already gone through this process, he recognized right away that this man was having a problem. And so he talked to him for a while, and he was able to take the man's cell phone, because the man wasn't sure where he lived at that point, took his cell phone and called the first number on there, which ended up having to be his wife. Wife was like, oh my God, he's been missing for 3 days, and he was from like Rhode Island. So somehow he got on the bus, somehow he got from here to there, nobody recognizing the fact that this man was having a problem.
Right.
And fortunately, this man at the liquor store, because of his experience with somebody with Alzheimer's, was able to recognize that.
Because physically,
we all should be able to recognize it.
We should all be able to, in a dementia-friendly community.
Right.
Now, I remember another one of the suggestions that I've heard you talk about was this notion of through the process in a dementia-friendly community of meeting other folks who are taking care of folks, ideally finding some caregivers like yourself.
Right.
And doing some training. Can you talk about that a little bit?
I think what I really talked about was sharing responsibilities.
Yes.
Similar to what mothers used to do in the neighborhoods when
we were growing up.
Right. It's like, if you take my crew, I'll take yours tomorrow, so you can go do some shopping.
Right. Or you get several people together with several folks who need care, and all of a sudden there's a lot of eyes around, so you're not worried about it.
Right. And we've talked about memory cafes. Memory cafes are a way for folks like myself and my mom to get together with other folks in the same boat and help each other, talk about it, just giving you some comic relief maybe for a little while. And that's where you would learn, where you would make those connections to possibly share responsibilities.
Because you're meeting some people who are going through a lot of these very same things.
Right.
So you, not only can you be kind of teaching
and giving them, and you get an opportunity to decide whether you're comfortable with that other caregiver, and build a relationship, and possibly turn it into each other, helping each other.
Yes, without being kind of forced into it.
Right. And so a memory cafe, you asked me what that was that's maybe a restaurant. what's the word I want, host that.
Mm-hmm.
And so maybe it's on an afternoon or an early evening where they don't typically have a lot of business, or they have a certain
right.
section of the restaurant that they can kind of close off.
Right.
Invite folks like myself and my mom to this. Maybe they have a little music, or I don't know, maybe there's some type of craft we're going to do, or whatever it is, and have a meal where we don't have to make a lot of decisions about what we're going to eat, and that
not
type
too
of
many
thing.
choices.
And we can do some networking.
Yes.
Not only caregiver to caregiver, but person to person, as far as the person that has the dementia.
Right, because so many people don't realize that
other people are going through it.
Yeah, right, and that if you have dementia, you like talking with people who have dementia.
Right, because they're not judging you.
Yeah, and they're repeating too.
Right.
And so it's like you can keep telling the same joke over and over again. It stays funny, you know? And the fact that you have trouble becomes funny.
Well, and it's also, I'm not the only
embarrassment.
one. I don't need to be embarrassed about that. There's a lot of us out there,
There's a
you
lot.
know.
There's a lot of
like
us
my
out
mom says, oh yeah, a lot of people have that, you know.
Yeah.
Not quite sure she understands she has it, but
That's great.
There's a lot of other people that have it.
There's a lot of folks that have. Well,
know?
I think one of the, you know, as you described that, I think I was mentioning before we started that I've started doing my interviews. So I'm one of the people going out doing interviews.
Right.
And every single person that I have talked to so far, these are the lawyers, financial plan, every single one of them had somebody literally in their family who has had dementia.
Yeah.
Right? And so it's like you don't realize how prevalent it is, you know, until you start talking to people, perhaps because there is such a stigma.
Right.
And so everyone is kind of dealing with someone, but no one's kind of like talking about it.
Right.
And if you mention it to someone,
one
the
in
immediate
eight,
reaction
I
is
think.
like, oh, that's too bad. Isn't that sad? You know?
I think the Alzheimer's, we were saying 1 in 9 folks will have some form of dementia. The Alzheimer's Association has actually changed that now to 1 in 8.
Yes, of
You
people
know?
like over 65.
And I've
or
said
something,
this before, that's what the Alzheimer's Association knows about. They don't know about all those other folks that haven't been diagnosed,
Right.
that are at
Right.
home, that somebody's taking care of.
People like you and me that are having trouble remembering
Right,
right now.
right.
Right now. That's true.
Right,
That's
and
very
as our generation gets older, the baby boomers, the numbers are just going to continue to grow.
That's right. And for both of us, I mean, we're sensitive to it because, you know, your mother's going through it. My mother died in a nursing home.
Right.
My older brother has a diagnosis.
Right.
And so it's great because the community that you're describing, the dementia-friendly community, is exactly the place where we would want to live as we get older. You know, a place where we could get a little confused, get even very confused, but not be embarrassed to live there. Not be embarrassed to leave, to get out of the house and go to the store or go to the restaurant, you know, and kind of live a life, so I think what
similar to the Americans Disability Act, you know.
In many ways,
you know,
the
I mean,
same.
think about how many folks were not getting out in the past because there weren't elevators and there weren't ramps and there weren't curb cuts. You know, so somebody else was doing their shopping for them. They didn't have the ability to go out and do that.
I remember reading about this one store in England that the store manager was committed to being dementia friendly, and he talked about it in terms of doing mental ramps. He said, you know, there used to be, you couldn't get up the stairs, you couldn't come in the store, you know, and then now we have ramps.
Right.
So maybe people need some mental ramps. They still can go shopping. They just need a little help.
A little bit of help.
They just need a little bit of help.
Yeah.
So Cindy, obviously, I think it's wonderful what you're doing. I think you've made such a contribution in terms of helping folks do this in a way that is kind of really organized and kind of moving it on schedule. And I think that's been a really wonderful thing that you've contributed to this.
Thanks.
I know it's been a lot of hours.
Thanks.
Right?
It's okay.
But it's just wonderful what you're doing.
Thanks.
And I think, you know, good luck over the next several months. And hopefully we can have you on and maybe Kelly and Carol DiRienzo
yes.
when you're done.
Yeah,
like in
I do
October
want to
and November.
mention, I have a couple of co-chairs in Northborough.
Yeah.
Carol DiRienzo that you've mentioned before, she's the nurse carpenter. And also
who lives here in Northborough.
Right,
Yeah.
and also Jocelyn Earhart. She is the outreach coordinator at the Northborough Senior Center.
Oh, that's great. And she's really actively.
So between the three of us, we're kind of running the show over there.
That's terrific.
Which is great.
Right.
And I do want to mention that if anybody has any questions about this at all, they can either call Kelly Burke at the Senior Center, or they can email me. My email address is ccormier, CCORMIER, at baypath.org.
And we're going to try to get that
Feel
on the banner
free,
also.
feel free to give me, send me an email. I encourage folks, if somebody approaches you about filling out one of these surveys, that they do it. It'll take 20 minutes of your time. Like I said, if you need us to leave it with you, that's fine too. But the more information we get, the better the outcome will be.
Right.
The better the actions will be.
Right, because the goal is to have this really be something that is this is dementia-friendly Northborough. This isn't dementia-friendly Wayland. This isn't dementia-friendly Shute.
Right.
It's what is unique to Northborough that can make this really happen.
Each town, each city has different needs,
Right.
and that's what we're trying to identify and take care of.
That's true. So, Cindy, thank you very, very much.
You're very welcome.
Thanks for watching. I hope you enjoyed this, and I hope to see you on the next installment of Bergeron Briefs. Thank you.